if you'd be so kind.
Let's
And I can share it too. Let's see. Well, when we get in, I'll share it.
All right. Let's see if we're tagged. Chill Coffee Public. So let me go to
Kelly or Joe. Are they joining us?
I haven't heard back from Joe, which is surprising. Normally, he's always right there. And then Kelly, she's been still working at the hospital, and she.
Oh, I know. I was kind of hopeful that maybe she would be able to join because I wanted to hear, really what's going on. So it's all good. Believe me, I can't wait to share the hour with you, Tom. There's so much to talk about. Joe, are they joining us?
I haven't heard back from Joe, which is surprising. Normally, he's always
There's
right
the
there.
feedback,
And then Kelly. There we go. All right. So can you hear me now?
I can, sure. Yeah.
Okay, fantastic. So we're on. I've got a watch party going. Hello, everybody. How's everybody doing? This is I'm Tom Quigley with Chill Coffee, founder of Florida Cannabis Coalition, Green Carpet Events. I've been an advocate for cannabis ever since I had an ailment of my own back in 2013, and I'm joined today by Dr. Barry Gordan, one of the top physicians in the state. If you know Dr. Barry, he's been a longtime advocate, educator, and one of the leading physicians. And we're supposed to have two other of the leading doctors on with us today, but I believe each of them had a few conflicts that occurred last minute this morning. So, Dr. Barry, how are you doing?
Well, listen, Kelly King, of course, I call her the Wonder Woman of medical cannabis in the state of Florida. She's working on the COVID floor, of course, as a hospitalist. So, God, kudos to her. And we make sure that we keep her in our thoughts for safety and health, And Joe, listen, it is 7:10 day. I wouldn't be surprised if he hopped on at some point, during the gig. But listen, I got Harry Anslinger on my back shoulder here, and what a day to talk about all kinds of things, Tom, in the cannabis world, of course. And I think just starting out, let's just start with, we are now essential medicine, right? On 7/10 of 2020. And isn't that a fantastic thing? So if there's one small little positive, and there's not many, of course, in the whole COVID crisis, I think being deemed essential to our patients and quite frankly to society is something I'm never giving back.
Absolutely. And, it's amazing. We also have extended, from what I understand, telehealth. So we've got a few new things going on.
Well, that's interesting, Tom, and we're not going to get overly political. We like to call it the green zone here, so we don't try to get overly blue or overly red. But interestingly, the extension of the telehealth really is predicated on Governor DeSantis issuing an entire new 60-day, right, state of emergency in the state of Florida. Hey, Don, why don't you start a watch party from the Compassionate Cannabis Clinic page or something like that too? Anyway, because listen, this is a Noctopia virtual event, and there's some charitable relief things going on too. I want to make sure we get to it. But anyway, the point is that Governor DeSantis had to issue an entire new 60-day state of emergency for the state of Florida. Now, did you see that in his news conference on Tuesday, right? No, it wasn't announced then. Have you seen it as a headline in any major paper or on the news? It's so interesting how things are coming down. I told you Joe would pop in here, Tom. I knew he wouldn't be able to stay away. Hi, Joe.
How you doing? Hey, it's hard to look like this, okay?
I love it. You became dressed for it.
I came the other way, Joe.
It takes effort to have put on my little tie-dye cannabis bow tie.
Hang on. I got one too, actually. Right?
Look at you.
Oh, yeah. I was supposed to wear this to a charity event, a masked ball. I got a tux, and this is my mask for the masked ball.
I feel so underrepresented. I love the bow ties. And I'll tell you what, Joe, I look forward to whenever you're speaking all around the world, showing the different bow ties that you have on and the meanings and the socks.
I was going to show my cannabis socks today, but I will not. Listen, Joe, when we were talking about the fact that
we're on the COVID-19, so there's the socks.
Listen, what we were talking about when you popped on, and I know you're going to have your comments to it, is that, listen, we got our 60-day extension for telehealth this time, which is great because what happened, Tom, was they took Surgeon General Rivke's out of the equation about a week before. So there was an update that talked about sports teams in Florida and this and that. And at that point, it was deemed that whatever the governor decided on the emergency order, that telehealth would be swept in. Now, what we were saying, Joe, and I know you're probably interested in this as much as I was, we got the full 60 days on Tuesday after the news conference that the governor had, at which time he never announced a new state of emergency in the state of Florida, right? It's so interesting. And it's like certain things get done under the table. So that whole 60-day announcement, I've never seen on the front page of the newspaper, on any type of news story, but that's what it took for us to be deemed, once again, to be included. And listen, being deemed essential medicine, Joe, is something that we're never giving back to them. And if there's one small little sliver of positive out of COVID for us, that's it.
Yeah, and it's really changed the perception of. I meet with a ton of people that are non-cannabis consumers on a daily basis, and I'm seeing the shift in their attitude towards cannabis. A lot of people early on that were coming on, and they're seeing this, and it's impactful, and that's why being top physicians and taking care of patients like the both of you do is extremely important, because that public perception is reality.
Well, I'm surprised. Well, I did hear, they did make an announcement about the emergency order, that it was extended. But what I find the governor doing, once again, talking out of both sides of his mouth, that we are under an emergency order for 60 days, which is going to take us to Labor Day weekend. However, it's okay to open the schools in August. What kind of shit is that?
Yeah.
We're under an emergency order. We can't go, patients should not be going to doctor's offices. We can do telemedicine, but yet our kids can go to school in August, and it's just like going to Home Depot. What?
Joe, I was gonna try to avoid the political side of it, but leadership is key. And I'd like to say that leadership should come from science, right? From science, not from politics. And I think from the physician side of things, one of the most distressing things to me about this entire process is that it unfortunately has become politicized. So, for example, here in Sarasota County, we absolutely have patients will come to the door. We have a temperature check at the door. We ask patients to put the mask on that we provide for them at the door before they come on in. There are patients who will say, you know what? I'm not going to let you check my temp, and I'm not going to put on the mask. I told my staff on day one early on, we're not going to get mad at anybody for their personal beliefs. I'll walk out into the parking lot and see the patient there, because I want to keep people, and Joe, I know you're going to agree with me on this. I want no one to lose their cannabis recommendation at this critical time. Okay,
They need it. It's like breathing. It's like water. It's like air. They need it.
Listen, it's one of the jokes I make with my patients, and there's never a time to lose your cannabis recommendation, but surely not now. So I'm not going to let things like that get in the way of me keeping my patients having safe, legal, and continued education about medical cannabis. So I've been out to the parking lot to see some patients. Vast majority will be happy to follow the rules at this particular extent, but I do believe there has been a leadership vacuum, no doubt, at the national level, no doubt, of course. And listen, the state is the state. I do give Governor DeSantis kudos for including us. But it's such a narrow sliver of the entire issue. And, you're right, Joe, the opening of schools, and it's not just the kids, it's the teachers, quite frankly. And, this is how I liken the whole crisis to my patients. It's 100 pieces of candy in a candy jar. 2 of the pieces of candy are likely to kill me, okay, or may kill me. 20 pieces of candy are absolutely going to get me sick. I'm going to have fever. I'm going to be chilled. I'm going to have 14 days of quarantine at the very least if I test positive, right? And then there's 28 pieces of candy or 78 pieces of candy that probably won't do much of anything to me. I'm still keeping my hand out of the candy jar, okay, until I'm freaking hungry, right? And then at that point, I'm going to stick my hand into the jar, because that's where we're at as a society right now, right? But if I'm going to stick my hand into the jar and I got some gloves, I'm going to take every precaution, or maybe figure out what pieces of candy are bad for me or not. But I'm surely a masker, And it fascinates me that, listen, a funny thing is, you'll see people, and Joe, I know you've laughed at this with me too. And Tom, I want to go back to what you say. You're now seeing what Joe and I have seen for the past 3 years. Not that you haven't been actively involved in the cannabis community. Of course you have been. But now you're dealing with the doobie ones coming in every day who have never used cannabis, okay? And the doobie twos that used it 20 or 30 or 40 years ago and have no idea what CBD is or CBG or CBN, you know, and you have the doobie threes coming in that are saying, oh my God, thank God I have my card, you know, and this and that. So you're seeing what Joe and I have seen for the past 3 years, and it is a joy. It is a joy. And when I say to you that the wall that was up here has been knocked down to here, and the wall that was down here is now built up to here, that's about where we're at. But here's the point. We really haven't even scratched the surface yet, right? Yeah. Because the two big things that are going to happen in cannabis world really haven't happened yet. One is the research that we're going to find out about the new cannabinoids, you know, what we don't know about THC, of course, and even CBD. Nothing's been researched. And the second thing is the legal adult use, right, of cannabis, you know, nationwide. So we're just scratching the surface, you know, literally. You know,
it's so true. And I'm meeting people that you would assume they look like old hippies. I'll put it that way. But they haven't consumed cannabis in 20 years, 30 years. And they're coming in and they're opening up to you one-on-one. And they're like, Tom, I really don't know anything about this stuff. And they're so confused and they're going out. But it's like a whole new journey for them that they're finding relief. And then, you know, they are making some stumbles, you know, consuming a little bit too much of powerful cannabis that they didn't know was out on the market. But for the most place, it's really eye-opening to see these people, you know, saying, hey, I want to bring mom in here to meet you and talk to you. You know, 420 is a holiday, so to speak. 710, another holiday. I think the last time the three of us were together was on 420 doing the same type of a video. And in just this 3 to 4 months, I definitely can see a shift, especially because we're deemed essential medicine with cannabis. And I'd love to see that as, you know, a positive coming out of what's happening in the world right now, for sure.
Listen, on the flip side of that is, for example, on my Instagram page, every few days I post, you know, a tip or a fact or something. And so a few weeks ago, I posted one on, you know, what's the difference between CBD and THC? And one of my followers sent me a message and gave me a bunch of shit about, you know, at this stage of the game, why are you still talking about the difference between CBD and THC? You know, that's so basic. You're wasting time. If you have somebody doing your marketing, they really need to step up. And so I responded to him and I said, look, until every man, woman, child is using cannabis in the world, I must continue to explain the difference between CBD and THC, because people still don't know the difference between CBD and THC. On a daily basis, Tom, you're hearing it on a daily basis. I know Barry and I hear it on a daily basis. You know, next month is going to be 4 years that I've been recommending cannabis in the state of Florida. And it's to this day, you know, I'm walking down the street or I'm in an event and someone will come up to me that knows who I am or what I do or has heard about me. And they're like, hey, doc, you know, that CBD that they sell at, you know, at the gas station, you know, is that any good? Is that going to get me high? Like, holy. So yes, the conversation is starting and it's happening.
And that's the math.
But the frustrating thing to us, guys, us three as we sit here, everybody who's on a share right now, a watch party, whatever, to share with somebody that doesn't know anything about the medical program in Florida. And that's my big goal right now, is to expand the eyes out from those. And Joe, you're viewer guy, I got it, right? Because I want to get to those eyes out there right now that don't know, right? That know nothing. See, and to me, there's two sides to the battlefield, and we've discussed this. The prohibitionists are easy these days because they just follow the drumbeat of THC, potency of THC, percentage of THC. And all you have to do to say to them is, well, how about the CBD and the CBC and the CBG, the mother of all cannabinoids, and CBN and THCV, that may be an appetite suppressant. And when they blank out, be they doctor, politician, conservative, whatever it may be, then you know you have them. because if they're interested enough to be open-minded, especially the doctors, we as clinicians can open their minds to the buffoonery, right, that we've witnessed in the past 40 years, right, where narcotics have killed people, alcohol and tobacco continue to kill people, depression and suicide and gun violence and auto accidents. Cannabis is nothing more than a substance in society that needs to be appropriately integrated with instruction, safety, and the enhancement of life. And I know you're a big believer in that, but my point is that's called being a 2020 clinician, not a 1980 clinician who didn't know these things. It would be immoral of me, right, quite frankly, to be a 1980 clinician right now and continue to push the Ativan and the Xanax and the gabapentin and the narcotics. There's plenty of doctors that'll do that. So our role, right, and listen, Joe, you're as fervent as I am, and that's why you and I can always hop on together. But and you're right, the people that normally have seen us in this, that they don't need that THC, terpene, flavonoid. A lot of those people don't need that conversation, but the vast majority do. How do we get to them? So
yeah.
Share this, people, on sites that don't normally have this type of impact. Because listen, let's lead into oils. It is 710 day. And I love to listen to Joe talk about such things because he's smarter than me about a lot of things. But he is, because he's an internal medicine doctor, and I'm nothing but just ER doctor, societal doctor. And he knows I don't BS about this. I speak to this all the time. But as a clinician that had to come into cannabis from the conventional Western healthcare world, right? To me, the advantage of the Florida program, even though we didn't start with flower and it took us till March 23rd, year and a half in or whatever, but we had to learn oils. So when I came into the cannabis world, I had to learn what CBD and THC and CBN and all the cannabinoids. I'm not saying in other states that those doctors didn't have to learn that, but when flower's out there first, right? And Joe, I'd be interested in your opinion on this. When flower's out there first, I don't think that you have the exact same entry, into the cannabis world as you do when you don't, right? And I think it's been to the advantage of us in Florida that we did start with the oils, because I think it surely forced me to get a lot deeper into the receptors and what does this and who does what. And that doesn't mean that you can't be a cannabis clinician without knowing those things, but you're sure better off when you do for your patients. And it's the myriad of techniques of extraction, right? Be it, ice or alcohol or butane or dry press, whatever it may be, that allows for the full terpene and flavonoid and cannabinoid profile that is so interesting in the oil world, right?
You're saying something so important, and I agree with you 150%. We actually fast-tracked the conversation about terpenes in Florida. California, the program out there, Washington, even in Oregon, they were just talking about flower, what flower was out there. And this full phytocannabinoid-rich plant, because it was, made into these concentrates with terpene profiles for different effects, I think has fast-tracked, and we have a much more educated consumer because of the physicians that are helping them to get their medical card, obviously.
No, exactly. The fact that we started with the oils, it kind of allowed us to ramp up and educate the patients better, because then when flower was available, many patients, will say, you know what? I'm getting the relief I need with the oils. Leave me where I'm at. I don't need the flower, because we offer it to them. When they come back, it's like, hey, it's available now. Are you interested? And we always educate. Look, you're not only going to need to smoke it. You can use it to juice. You can put it in your juicer. You can cook with it. You can extract. Put it in your oils and your butters, make your oil.
Tom Hanks. You don't want me to do my best Tom Hanks routine. You can make this with it. You can make Bubba Gump, right?
Gumbo.
True. Listen, that's why in my
I want to say something real quick for those people watching right now that don't know what 710 means and why we're talking about oil. If you turn 710 upside down it's spelled oil. So that's where the date 710 came from and why we're talking about oil today. Let's go on. I just wanted
the pager and beeper days. For those people, for the millennials who don't know what the hell a pager or a beeper is.
A lot of people don't know why 710 is a specific day for this, and it's oil upside down. I mean, I was asked it yesterday. What does it matter? Why are you doing this on 710?
Well, no, it's kind of funny because it's the 210-day order system in Florida, right? People say, why 210 days? I say, I have
420.
It's not half of 420. They're not that smart at the OMU level. So, but I think it's so important about that conversation with the oils, because you're right, Joe. Some patients don't want flour after having the exposure of the clean vaporization inhalation techniques. And in my clinic, we always make it a point. We don't call flower products smokable cannabis. We call it whole flower excess program cannabis, so that we can teach whole flower vaporization techniques. Because let's face it, listen, a lot of our old timers that have used cannabis for years, the greatest joy that we take in the introduction of the medical program to that type of guy is the augmentation of the THC that they're always comfortable with, and then the CBD underside that they've never known anything about. And now, you can see products in any of the dispensaries that have a wonderful CBD content in the flower, right? Including, 8/6s or 24/6s, 24% THC, believe it or not, and a 6% underside. If you can teach that veteran to not smoke that cannabis anymore, but vape that high THC and CBD moderate product, a lot of that product is unbelievable because they're not 18 anymore, right? So I love when I use that line on my patients, because, when you're 18, all you want is the THC component, and I got it. But on the other hand, as you get into the adult medical world, the anxiety, depression, the autoimmune, the anti-inflammatory, the anti-cancer, you definitely want that full spectrum product. I want to get back to that CBD discussion too, Joe, because, like I was saying, the prohibitionists are easy. We got them, okay, and Alex Berenson and Bertha Madras and this and that. That's why they don't call us to Tallahassee to debate them, because we'll win that argument. We'll win that argument every time, and we're the experts that have done this, and we've been in medicine for a long time. But the CBD side of the equation is a very interesting equation too. Listen, one of the things that I heard in the past couple of days really bugged me. And high quality.
Closer, Tom.
Yeah, this is oil syringe. So for anybody that I just so happen to have an RSO oil syringe here to show. So basically, it's a syringe like this with the oil, and the oil is a high concentrate, sometimes up to 900 milligrams of THC in 1 full gram. So a little dot of this oil could be anywhere from 20 to 80 milligrams of pure THC that you can utilize. So that's what an oil. And then with that oil, there's different strains and terpene profiles and different effects that it has. So, I think that, oils for people, especially for patients like myself, this helps me to be able to dial in those ratios when they're starting to create. Yeah. So now
you got to have gray hair like all of us, but it's like the old Brill cream commercial, a little dabble do you, right? Brill cream, little dabble do you. No, but seriously, Tom, and I want to give a shout out to you. And, listen, you've opened up your shop, fantastically so. And you're what I like to call a CBD purveyor who cares. You care, about sourcing your product appropriately, right? Full spectrum product, well-labeled product, the best testing that you can achieve on your product, right? And you don't make false health claims about your product, right? And that to me is why I respect you and other appropriate CBD purveyors, and I always will. On the other hand, we know that not everybody is you. So the gas station vape shop CBD, the side of the road guy, that guy, whatever, got to be careful in what you buy.
Because they're selling them anything. I get people coming in and I look at the labels and I go over the label with customers and they have no idea what they're getting. Sometimes it's through network marketing or multi-level marketing programs. Other times it's at the gas station. And, that's really the reason that I wanted to do this, especially in my hometown, because I've been traveling the whole country preaching both sides of it. And I tell everybody, I'm a medical patient, and this is part of my treatment, and if this works for you, there's a potential that you could get off these other medications that you're on. And that's the other piece, is their doctors are scaring them into staying on the pain medications, and that if they seek cannabis treatment, that they're going to lose them as a pain management doctor. So I see that other side of it all the time.
The good news is, though, so much less than it was 3 years ago.
Yes.
And I think Joe would agree on this, that once again, it's the knocking down of this wall and the building up of the others. So we do have some pain management guys that really are not working with us, but the majority of them do work with us now. And that's a great thing. But I want to get back to the point about the CBD, because, Joe, I think you have a CBD product in your office as well. So yeah. my point is, the appropriate CBD product that comes with appropriate testing and full spectrum product and appropriate advice. And, because listen, some people can't use a THC product. Your cop, your pilot, your this, your that. I got it. But where I take offense is that, believe it or not, and I heard this the past couple of days, and I heard it from more than one source, there are doctors out there that are not putting in a CBD product for their patients, into the medical registry orders, because they want to sell their own CBD product out of their office.
Oh.
And I've known about that in certain pain management offices, where they'll only allow the patient to use their white labeled CBD. And if they come in to see me, then they're going to be pitched out of the program. I don't see that too much anymore, but I've actually heard this about medical cannabis providers. Oh, there she is. The much better half. Oh, Ativa too, because Joe had his.
And a Nugtopia shirt.
Right, on an Nugtopia shirt. Fantastic. But I think it's an important issue, because when you walk into a medical cannabis provider, you should be able to achieve all the orders within the program, right? And if you're not going to allow your patient to have that CBD order because you want to purvey that product out of your office, I got to be honest with you. I mean, that's to me, and Joe, we have our Justice League, and that's never come up in the Justice League, and it probably won't come up in the Justice League. But I'll be honest with you, I would call a doctor out on the Justice League for something like that, and I don't think that would be a practice that you would agree with.
Especially when we know about the entourage effect. And so to push and promote a product because that's what you sell, but at the same time you're pushing and promoting pharmacologicals, it's like promoting morality in your underwear. It just doesn't work right.
Yeah, but
it's interesting because
purchase your CBD out of your office. You have no issues with that, but I don't think that you're withholding a CBD order within the MMU registry, so that patient would have to buy the CBD product from you, right? I know that. I mean, I'm not assuming that you would say that you would disagree with that, but I would assume that you would disagree with that. If the patient wants to purchase your CBD, of course, fantastic, great, because you are providing a good high-level quality CBD product that you believe in. And if they want to supplement, MMTC, THC with that product, then you surely have no problem with it. But my point is, you're not restricting your patient from CBD in the registry.
Never.
Of course. That's my point.
Yeah.
I've heard that people are doing that. And I'll be honest with you, that would be the kind of thing that I would call out in public.
Yeah.
Well, people, patients ask us, what's the difference between the CBD that you're selling here in your office and the CBD that I would get at the dispensary? And so that we get into the conversation of, well, that CBD that we sell here comes from hemp. That, the CBD that you're going to get at the dispensary is coming from the actual cannabis plant. And so we talk about the differences between hemp and cannabis and that whole lineage. But really, the purpose for us having that CBD in our office is to get patients started on it while they're waiting for their card.
Exactly.
As soon as they get their card, then they really don't need the over-the-counter CBD. They just get it at the dispensary.
Yep. And that's even true with the patient, because we also appeal to patients that come through the area as well here. So we have Move, their over-the-counter line. We have Fluent as their over-the-counter line. And, I wish a few of the other dispensaries would come out with over-the-counter lines for the physicians, even to get the patients started on so they could become familiar. But I always tell them also the ratios are very different. So the CBD ratios that you're getting from the marijuana plant are definitely different than what's coming out of the hemp. Now, a lot of the hemp plant that's out there is being bred much differently. But, that's almost a way of saying, okay, well, this is something that works for me. I need to graduate to, the medical program because the over-the-counter works at a certain level. And there's a lot of people that use both. They use some CBD that's over-the-counter because they like it, whether it's gummies, because gummies aren't available in the dispensary.
No doubt. Or
Exactly.
Or coffee or tea, Tom.
Or coffee or tea, or all
seriously. And believe me, that's, like I said, that's a reasonable approach. And if I was going to do a CBD line, I would have done it early in the program when patients had to. Everybody remember the 90-day waiting period, of course. And then, of course, there were 2 months or so, and Joe will tell you that we have to give the OMU their credit in mopping that up a little bit. Nobody waits 2 months to get their email back from them at this point. It tends to be 2 weeks. So you're right, Joe. But some people will continue to use various, you're right, Tom, gummy products, other such things that really aren't available in the Florida market. And I say, hey, viva la botany, as we say. So long live it, that they may be able to breed, those wonderful hemp varieties higher in CBG or CBC or THCV, which is going to be a real winner for somebody, of course, because that's an appetite suppressant.
Let's talk about THCV real quick for people that don't know about it. I know we've talked about it in the past, but I mean, I need an appetite suppressant. I don't know if you've seen the cinnamon buns my wife makes here, but I think I put on like 8 pounds last 2 weeks.
I think it's probably one of the best pre-COVID, things that I saw. Are you going to come out 20 pounds up or 20 pounds down, at the end of all of this? Because, the stress may make you not eat. On the other hand, sheltering in place with the beautiful cinnamon rolls, Tom, will surely do it. But yeah, let's go THCV. It's an interesting cannabinoid.
I mean, it is euphoric. It's one of the euphorics, kind of like CBN. THC, THCV is one of the euphoric ones. Not only does it work as an appetite suppressant, but it also works as an anti-diabetic because it blocks or diminishes the levels of resistin, which resistin is a hormone that causes insulin. Insulin. I'm at a loss. I need help. Insulin resistance. Thank you very much.
I was writing down notes from you teaching me, Joe.
So insulin resistance. And so the THCV blocks or diminishes the levels of resistance so that it eliminates that insulin resistance. And we've had many patients that have either reduced their dosage of insulin or are no longer injecting themselves with insulin and are just using oral anti-diabetic medication, and many have gotten off of the oral anti-diabetics. So it helps with diabetes together with the appetite suppression, but also it's amazing for pain. It helps with PTSD, anxiety, and stress because of that euphoric sensation. And it also has a neuroprotective function where it reduces tremors with Parkinson's as well as familial tremors. So these are all amazing benefits. So yeah, it helps with weight loss, it helps with diabetes, but it also can be used with all of the other qualifying conditions that we have, the PTSD, the Parkinson's disease, etc.
Yeah, the great thing about the Florida program in a lot of ways, hey, it's not perfect, but getting better all the time. They are starting to label all the minor cannabinoids, right? To that extent, the terpenes. And listen, Joe, when you say things like this, listen, my colleague, Dr. Rosado, and I have not had a chance to hear the lecture yet because it was canceled prior to COVID-19. He's got the whole erectile dysfunction lecture.
I did it last night. I did it last night.
Where was that? On English or in Spanish? Because I wouldn't have
English. I did it in English. You could have understood.
I understood about half of it. Listen, here's the intriguing thing, and these are my pins, and I got a bunch of them because it was also pre-COVID. No research, no peace, right? Because it's the things that Joe was talking about, the receptors, the ACE2 receptor that we know is the active entrance into the body from, you guys want to talk COVID-19. So are we doing the research here in the United States? It's critical? Of course not. Okay.
Oh, by the way, with research, not to interrupt you, September or October, we're going to be doing for Dr. Sue Sicily, and I'm working on having her come out here as long as we're back to everything normal, which is doing some of the research in the States.
I want to know how Sue gets her dog everywhere.
Oh,
And I mean,
Dodger's amazing. Yeah.
Oh, I know, but so is Tiva. But I don't think that I'm going to get Tiva. You know, I don't know. It's amazing how she gets that dog everywhere, cross country lines, this, that, whatever. Love Dodger, man. No, and Sue, listen, the cannabis world is interesting right now, Joe. And listen, I'm sorry that I missed your talk last night. But there's so many things going on. You know, want to give.
But if you send me your email address, or those of you that are streaming and listening, if you guys send me your email address, I will forward it to the ACCBD group, and next week they're cleaning up the video and the recording and everything, making it presentable. But it'll be available next week, and you'll be getting an hour of CME from Washington University in Missouri. So it's a recognized CME course.
Very good. Yeah, it's cool. Once again, just a continuation of the essential, basis of cannabis these days. But, it's so spotty, but no, and once again, the ACE2 receptor, Joe. So give us a little COVID update, Joe. What are you seeing in your practice? Because I know you see general medicine patients as well. What's going on? And Kelly, of course, is either sleeping or
at the hospital with her armor.
Oh my God, no! I saw what they have now. They actually got the little oxygen pack on the back, and the whole thing comes across. And I think the anesthesiology guys have that because they got to get up there and do the intubating. So I don't think that's normal, PPE equipment. But boy, the stuff they're coming up with is unbelievable.
I have a little part as a patient I want to brag about real quick that happened to me over COVID. So during COVID, I started increasing my CBD use to everything else, obviously, and I don't take blood pressure medicine anymore. About 3 weeks ago, I was getting dizzy in the mornings, and we couldn't figure out what it was. I got some blood tests done, and then we realized that it was the fact that I didn't need that blood pressure medicine anymore, and it was making my blood pressure drop. So I've been able to regulate myself over the last 3 months by doing a steady consumption every single day of
consistency is key.
And that's what it is. I don't know if it was, so it was about 30 days ago. So it was after about 60 days of real regular every day, making sure I did it every single morning use, that I was able to get off the only one medication that I was still on.
Well, my COVID update is I got COVID.
Did you?
I got
really?
it.
I did not know that. Tell us about it.
All right. It was you on our previous talk. I had mentioned what I was doing to protect myself and keep everything up, and so I was continuing that. I was doing my, I upped my CBD. I was doing an isolate CBG product, 200 milligrams at bedtime. I was, doing my vaping. I used the handheld inhaler from Move. Because
you have your asthma.
Exactly. I'm a COPD patient. And so because of my COPD, I have a morning routine that I do Advair, Atrovent, ProAir, and then my THC 1-to-1 inhalation from the Move, the handheld product. And then I do my CBD product under the tongue. And then that's my every morning routine, like clockwork. So I was fine, no symptoms, everything was good. Once they lifted the lockdown in Orange County and the restaurants were open at 75%, I went to a business meeting. There were 10 of us there. Of the 10 of us, 5 got sick.
Wow.
5 became COVID positive, and of the 5, 3 of us got ill. I was moderately ill. There was one that was severely ill, and then the other one was younger than me. They just lost sense of smell, sense of taste, and that was it. Just some generalized fatigue. I was in the middle. I got the high fever to the point where I woke up extremely dehydrated, euphoric. I got up. I knew I needed to be hydrated, but I was feeling very weak and tired. I passed out from the bathroom to my kitchen to go get something to drink. My puppy was the one, my puppy and my wife were the ones that found me laying on the ground because I just collapsed.
Wow.
So after the fact, I
You have
reached out.
night sweats, of course, and all that. And
Oh yeah. And then I lost partial sense of smell, partial sense of taste, which as a foodie killed me because I couldn't taste my food. Generalized body aches, muscle pain, kind of like what fibromyalgia patients described to us, I was experiencing. And so rather than listening to the president and getting hydroxychloroquine, I reached out to my friends overseas and some of my Indian doctor friends, some of my Mexican doctor friends, and said, hey, what are you guys using? What are you guys doing? And so I started a product called Neem, Neem, which is it's an Indian supplement. It's an Ayurvedic medicine. It's an antifungal, antibacterial, antiviral. It works on, they've had reports on patients with HIV, hepatitis. It works on cardiovascular disease, diabetes.
Is it the same as neem oil that's used on plants, Joe, that they talked about with the cannabis hyperemesis syndrome?
Yes, Neem, Neem. But the second name, like when you look at the botanical name, it's an indica. So I'm of the belief, I don't have proof of it, but I'm of the belief that it will work on the endocannabinoid system because it's an indica. So I did that, and then I got got into the mushroom world, and I purchased turkey tail, which is also an antioxidant to support that, and I incorporated those with what I was already doing, and I came out on the other side. Now, yesterday I listened.
When were you sick?
I got sick about a month ago.
Wow.
Yeah.
Wow.
Yeah,
So
about a month ago.
Glad to see you looking as well as you are, man.
Yeah, it was about a month ago that I got sick, and then it did last the 2 weeks. But the thing is that contrary to like the flu, this screws with you because one day you feel great, and then the next day you feel like shit, and it's up and down, and you're never ever like in a steady state. It's like up and down all the time. So it was crazy. But incorporating all of those things, I got my sense of smell back, I got my sense of taste back, my aches and pains are gone. But it was the incorporation and the adding of all of those things. But yesterday I listened to an audio of a physician in Texas who stated, and this is at Harvard University, they're keeping track of all the world numbers of diseases and deaths. Well, Taiwan, the population in Taiwan is 25 million. Okay, the population in Florida is 22 million. So there's a comparison there. The number of deaths as of yesterday in Florida were 4,000. The number of deaths in Taiwan were 7. So he researched this, and then he went to Japan, 121 million people, 15 deaths. So he reached out to doctors in these countries and asked them, what are you guys doing? And what he discovered was that they were using Pulmicort. You know that.
Yep.
Barry?
Yep.
It's an inhaled steroid, not an injectable. Remember at the beginning when they said, no, you don't want to use steroids, you don't want to use injectable steroids because it's going to make the problem worse. Well, what they were doing was inhaled steroids, and that has kept the numbers down. Why? It blocks that cytokine storm, the inflammation, directly in the lungs. Now, what helped me recover as quickly and as well as I did is because every morning I inhale Advair.
Sure.
Advair is a long-acting bronchodilator combined with a steroid. I also inhale what? A 1-to-1 CBD THC first thing in the morning, and then throughout the day I use Vitacan's or Tikkun Olam's product Midnight, which is a 1-to-1 all day. So throughout the day I was working on the inflammation in my lungs, and that kept me from getting worse than many of my colleagues or the other patient that got severely ill.
Yeah, and you're the one that had the COPD to begin with, Joe. Listen, listen. I want to ask you one more question about it. What type of testing did you have? Did you have the nasal swab originally? Have you done any blood convalescent?
I
have
did.
you tested negative since?
Well, here's the interesting thing. When we had antibody testing done in my community, I went and got it done, and it came back. I had my IgG checked, and it came back negative.
I remember that because Kelly and I talked about that at the time.
So I was negative for that, but now once I got all the symptoms and everything, I got retested and I came back positive. So now, no vaccine for me. Thank you, Fauci.
So do you have to screen negative nasally before you go to resume activities, or is there a presumption because your antibodies are where they are that you can't spread it anymore?
Technically, that's the belief, but because it's still so new, I'm being extremely cautious. The times that I have had to go into the office, like yesterday, we had, I had 3 new Suboxone patients that I had to go see face to face. I had my mask on. I was, I maintained my distance. I did everything that I was supposed to do, and I took extra precaution. I didn't come in through the main office entrance. I came in through, the back office entrance, minimized any contact with staff. So.
No, yeah, for sure. I mean, like I said, we've been lucky. I told my staff, this is actually before you hopped on the call. I tell my staff every day, we're one test away from having to change how we operate, That's myself, anybody on my staff, even a family member of a staff, whatever. But no, I'm so glad to see you well, Joe. Boy, I did not know that you had it. That was a good news lockdown, by the way, to that extent,
Yeah, and to see you so healthy as you're saying that, it kind of put my mind at ease. But, as soon as you hear that, and that's the thing, I've started hearing more people that I know that have contracted it, that have recovered, obviously. But there are more of those people. And then also I've come in contact with more people that have been forced to quarantine because somebody at their work, whether it was in our local area, there's Fred's, which is a breakfast place, and there's also Wawa's. And they had to, furlough 40 employees to all go get tested and shut down.
And that's why the 60 days for telehealth is so important. I think it really allows practices to take a deep breath. And, hopefully nobody in my practice will become ill and we won't have to shut down or this or that. But even if I get it, I'll lay in bed and shake and see my patients, for research.
That's what I did. I was laying in bed.
I know. And listen, fever in adults, I guess, listen, let's not go red or blue. But President Trump, this is not a nothing virus, okay? Believe me. When you get this virus, you don't want to have this virus. Representative Shervin Jones has it. He's doing a daily chronicle right now. He says the exact same thing that you say, Joe, that one day you feel like you're kind of getting back on it. And then the next day you're like run over by the truck again, So this is not a virus to mess with. And, let's face it, the capricious nature of who's really going to get that bad outcome, we just don't know. So, we got to be vigilant. I don't want to see the state close down all the way again. Nobody does. And talking about sending kids back to school again and this and that. We're going to come out of this on the other side, a much different society. And I think it's going to be a year, guys. I really do. And
well, it's 95 degrees up here, and it feels like 105, and we still have COVID. So that disputes Dr. Trump.
Well, it's almost a reverse thing down here in Florida because in Ohio, you're inside in the winter, right? And in Florida, you're inside, so to speak, more in the summer. So, as it is. But, bottom line is bottom line. Listen, it's not a virus to mess with. We got to be very cautious as we reopen the schools. I think sports aren't coming back for a while. I won't see the casino for a while. I don't know if anybody saw the report about flying. So, Joe, if you were going to travel right now, would you fly or would you drive?
My rule of thumb has always been if it's more than 4-hour drive, I'm going to fly. However, right now, the guy that flew to 8 different countries last year in 3 different states, I'm thinking twice about getting on a plane right now.
Feel weird when I go in Walmart and there's a big crowd of people right now, and I could see it. I even was standing talking to my wife the other day, and I had my mask. I just pulled it down, and I stepped away from her, 3 to 4 feet. So I'm starting to see myself develop new habits, so to speak, or new mannerisms. And, that's one of the things that I believe everybody's going to come out of this with.
Oh, listen, for the first 5 weeks, I had to have my stethoscope in one hand and my cell phone in the other because I'm a handshaker. I stayed out of the courtroom my entire 32-year, knock on wood, because I'm 5 years out. They can't get me now, Joe. The point is I stayed out of the courtroom because I'm a handshaker. I bonded with my patients when I walked into every ER visit forever and bonded with my patients. And on the way out, I shook hands and I answered every question that the family had.
And you're a hugger. You're on top of a hugger.
And I'm a hugger. So
we're huggers because a large percentage of my practice are Hispanics. And so how do we greet each other? We greet each other with a kiss on the cheek and a hug.
Indeed. Joe, I want to go back to your sickness. Did you have a pulse ox at home?
No, I did not. But the thing was that I never felt short of breath.
Interesting.
I never had any shortness of breath. I never had any difficulty breathing. But again, remember, I'm a COPDer, so I use my 4 inhalers every day religiously, twice a day. So.
My point is, I bought 4 of them on Amazon, and I've handed them out to patients and I've had a couple patients that have had COVID positive. I say, hey, come on into the office or send somebody in. I want to send you home with a pulse ox. Because the pulse ox is very important. It's the device you put on your thumb or any finger. It measures your oxygen level. At the start of your COVID illness, if anybody gets it, try to get a pulse ox before. It should be in your home right now like a thermometer. But the point is, when you start your illness, if you're at 96, 97, 98% consistently on your pulse ox, check it a couple times a day while you're ill. If your chest is tight, but your pulse ox is 96 or 97%, you're probably better out of the hospital. If your chest is tight and your pulse ox is decreasing and you get to 90% or 88%, get into the hospital. You don't want to get there when it's 80% or 78%. You may come into the hospital at 78%, and then an hour later, you may have a tube down your throat and your family's still outside wondering what the hell happened to you when you walked into the ER. So the only way sometimes you can know how sick you are is that pretty simple device that can still be bought on Amazon. I don't think you can find them in the drugstores right now.
I think that's a great takeaway. We have 10 minutes left. I wanted to, ask Dr. Joe and you, Dr. Barry. I think that's a great thing to have in your toolbox, so to speak. But what else can we do, to just build our immune systems? I know I'm trying to drink elderberry and I'm staying away from anything like, harmful or, these things to really build is neem, turkey tail, and, a CBD regimen.
This is my regimen, my daily regimen, which I've continued on since that. I've decreased the numbers of the capsules that I'm taking, but I'm still taking them. So vitamin A, I take 10,000 units of vitamin A with dinner. I take 1,000 units of vitamin E with dinner. I take 1,000 milligrams of vitamin C twice a day. I take the neem. I was taking 3 capsules. Now I'm down to 2 capsules of neem at bedtime. I take 2 capsules of the turkey tail at bedtime. I take 5,000 units of vitamin D with first thing in the morning and then with dinner. I take 60 milligrams or 30 milligrams of CBD twice a day, so 60 milligrams total per day. I take 200 milligrams of CBG at bedtime, and then I use my 1-to-1 midnight vape from Tikkun Olam, 3 1-second inhalations, which is about 2 milligrams. I do that every 2 to 4 hours because that's how long vapes last, 2 to 4 hours. So I do that throughout the day. And I take colostrum, 1,000 milligrams twice a day.
Wow.
So that's my regimen.
Wow, and I have 2 pieces of pepperoni pizza and a Dr. Pepper. But no, I'm teasing you. That's why I shut up and listened to Joe because, like I said, I'm just a dumb ER guy who, like I said, was up at 3:30 in the morning, eating pizza and drinking pop. But no, I mean, all those things are important, but, different strokes. I'll be honest with you. I just try to keep it simple. and maintain a moderate lifestyle and avoid those things that I know are going to harm me. Never smoke cigarettes, rarely on the alcohol side. Try to keep it simple and basic, and that's on top of working nights and shift work and this and that, but let me tell you, and I tell this to my patients, good way to wrap up. I see we have 5 minutes. I tell everybody, listen, if you're and let's make no assumptions here. If you're a Doobie 3 patient and you've used cannabis for years and it's your evening after you've been a banker and you got 500 employees and you got all the stress and anxiety and you go home and you'd rather have a lovely, beautiful, it used to be in the old days, Tom, you remember, Joe, you too, brown seeds, garbage, roll it down the tray, whatever. Now it's green, crystally, gorgeous, but it's a THC product, right? But the point is, if that's been your lifestyle through the years and now you're 65 years old and you're that banker guy, I guarantee you that you look 55 as compared to the alcohol banker guy who jams down a couple, 3 scotches every night and has a big cigar. He looks 75, right? So to me, we have to get beyond cannabis use disorder, right? And see that many, many people have utilized cannabis as their substance for good throughout their adult lives. And the joy, and I know Joe sees this, and he sees, God, Joe, it must be crazy when you go to these countries where they'll literally cut your hand off for being a cannabis user, right? But then I guarantee you probably still meet people there who are leading the charge and who somehow have obtained it or grown their own. I want to give a shout out to the South African community who lost one of their big warriors down there. And I can't bring his name up right in front of me right now. And I apologize for that. But, we have warriors all around the world, okay, that have been pushing for cannabis reforms, right? Always at risk of their own use, of course, of job, of relationships sometime, of the law. Like I said, cut your hand off, if they find you with a couple seeds or something like that. But the point is, why do people do it? Because they know it's a better substance for them than the Adderall, Ritalin, than the alcohol, than the narcotics, than the benzos, than the steroids, right? So cannabis use disorder, I think, is a term that is surely present in society and we can't ignore it. But the vast majority of adult cannabis users are appropriate substance users for their own good. Big difference. So as we get into 2020, and listen, 2021 is going to be no easier than 2020. I went to my eye doctor the other day. He was so disappointed. You know why, Joe? He goes, gosh darn it, 2020 was supposed to be the year of the eye. He goes, that went away pretty quickly. But listen,
yeah, my concern with this is what the sequela is. For example, with Epstein-Barr virus, everybody knows, okay, with the Epstein-Barr virus, you get mono. But then down the road, chronic fatigue, fibromyalgia, prediabetes, dyslipidemia, hypothyroidism, et cetera, et cetera. You get all these sequela. My concern is, what is the sequela going to be of this virus that nobody knows how it acts, behaves, or how to even treat? So listen, I was not going to raise my leg and raise my leg and piss on your leg, Joe, over the fact that you recovered. I'm teasing you, but yes, we don't know. And there are patients that, yes, a couple, 3, 4 months after do have chest tightness, and it's shown that they do have a mild pulmonary fibrosis. Did you take an aspirin, by the way, when you had COVID as well, as a mild, blood thinning effect, of course? Yes. Yes, because, how it displaces the hemoglobin molecule and causes blood clots. And I have a history of pulmonary emboli from, back in 2004, I had a pulmonary emboli. And so, I had multiple emboli. And, so once this happened, yeah, I was doing the aspirin as well. Right. We don't know. And that's why I think we have to continue to treat this virus as what it is, a novel, right, virus, new to humans. We don't know the long-term effects. We don't know if we're going to be able to find a vaccine, if this virus is going to be slipperier than we think, like the normal influenza, which is why we need to come up with 3 different vaccines every year, and they change every year. So we just don't know. It's only been around for 7 months. But Joe, I'm so gratified that you got through it. Like I said, I have a couple patients in my practice. So far, no one's ended up in the hospital, with any significant sequela. And for that, I'm happy. But
I took some notes from what Dr. Joe said. So I think I'm going to adhere to this going forward as well, because
I can't take that many pills, Tom. I just personally,
I got a few. I'm not going to do all the things. I just got like maybe the top 3. But
there's no capability of taking that many pills.
but I want to thank.
You can make a tea with all that stuff in there.
That's what I'm looking at. That's what I'm looking at. Our immunity tea. So
There you go.
know, I hope we can all get together in person real soon. Thank you, Nugtopia, for having us on. You guys are doing great things. It was great seeing both of you guys today. I know we've been busy over these last couple of months.
And it's nice to be seen.
It is. And, you know, thank you, Curly, for being a sponsor of Nugtopia's event as well. And let's all get out there and keep educating our neighbors, because there is a lot of people. The masses really do not know what's going on. And without people like ourselves and the people that are watching this today, you know, the word can't be spread as quickly as we need it to be spread, so we can start advancing with research, and we can start helping more people realize that there's choices out there.
Send a copy of the link to me, Tom, when you can.
I will. Thank you, guys, and I got to end this. My wife's calling me from up front. All right.
No problem. Take it easy, guys. Bye.
Have a great day, everybody.
Happy 710.